कर देंगे. I mean, I just wanted to ask you, how do you want to do it?
Can you hear us, team members?
I'm going to stand back, and you just go ahead and do it. And if you have any queries in between what you're doing, you ask me. Otherwise, I'll just let you go, do the thing. And if I find that something that you are not doing the way I do it, I'll tell you this is what I would do. Is that okay?
Hello, good morning. Okay.
I can see Naval.
Yeah.
Naval, so bolo, can you take the Sajda is there?
Yeah, Sajda. Okay, so we'll be starting today's case. Good morning, everybody. This is a young gentleman who came with abdominal pain, and he has a CT scan that shows a stone at the insertion of the CBD. His total bilirubin is 3.9 with an deranged alphos as well. So we'll be doing his ERCP.
Am I audible? Sajda, can you hear me? I can't hear you. Wait, Sajda's mic is off. वहाँ से आवाज़ मुझे नहीं आ रही. अबे पहले चेक करना होगा.
We'll ask the ANR guys to check your mic because we can't hear you.
We carry on. Sajda, we can't hear you, but you can tell anybody, I mean, people there, what is being done, and obviously if there are questions, then we'll take it.
Hello. Hello.
Yeah, we can hear you now.
Sir, we can hear you.
Okay, good, good, thanks.
Carry on.
Go ahead. Little bit of suction, well done. So when you see a lot of bubbles, and if they stop, this is okay, but if they start causing problems, you can use Infocol, mix it with water and squirt it, and the bubbles disappear. So it works very well. Okay. Yeah. Yeah. Well done. Can we have the screen, please? You can keep pulling advanced. I think you're doing the right thing. Just keep pulling back. Keep pulling back and just give a clockwise rotation. Keep pulling back. It will come back to you, don't worry. We can have the fluoro just to see what's happening to the scope here. Yes. See? Okay. Perfect. Yeah. Where do you think is the ampulla? It's 1 o'clock, yeah? So I would pull back the scope a bit, see what happens. Okay, and use your shoulders. See what happens, yeah? You've got a glimpse of the thing. Now you need to just position it. Just give me a fluoro again, just see, position it so just everybody can see. Yeah? Okay, good. So somehow I like you to bring it in the center of this, right? So once you've got a glimpse, you can use your shoulders, you can use your scope in and out. And you have wheels, right? So you can, yeah, good. See what the small wheels do. Away from you, so tip right, yeah? So complete right? Yeah, see if you can do complete right. Yeah, more right, full right. Now, but in the picture, so go, yeah. Change, just stop. Give Flora de right. Yeah, still not bad, but you need to, you see, thoda hockey ka stick straight kar sakte ho. So how do you do that? No, I mean, you know, the angle, see if you can push this ampulla away from you. So push this ampulla away from you, a little bit of torque again, and then pull back. Thoda sa aur. Right, now use your small wheel. I mean, tip left, thoda sa pull back again. Yeah, pull back. Pull your scope back. Yeah, good. Keep pulling it back. Keep pulling it back. Keep pulling your scope back. Yeah, now go in a little bit. Right, now tip right complete. So, big wheel should be, you know, away from you, tip down. Tip down more. And now pull back a little bit more. A little torque, clockwise. Yeah, that's it. Now you've got it almost where you want it. Thoda sa scope, I think I've introduced the scope a little bit more. Just a shade, just a little. Right? Okay. Now use your, again, right and left hip and see if you can position it a little bit better. Just pull back this. Flora, please. So piche kar do. Pull your scope back a little. Aajo, koi baat nahi, go back in. This is the time to actually play with it, right? Little bit. So patient is anesthetized, he's not uncomfortable, he's stable. So you can use all the things. Good. Keep doing that. And now, yeah, now pull back a little bit. Clockwise ke saath. And yeah, perfect. Go in now. Slowly go in. Advance your scope. I think you're very close to what you would want, so pull back a little bit. That's it. Now you can change the position. Yeah, now you can change your, you know, your ampulla is facing that way. You're going to come this way, right? So you need to bring it facing towards you and see if you can use your torque to do it, or, I mean, I use my small wheels and works very well as well. This is good. So, thoda sa dur hai, come, that's it, come back. But I think this is now a reasonable position for you to have a go, right? Just describe the ampullary orifice to me and tell me where would you think you would want to go in and what is going through your mind.
So ampullary orifice is probably
Yeah.
the center.
Yeah.
In terms of angle where the CBD is going.
So the CBD is going this way, right?
Yeah.
Right? And you need to go somewhere at the apex. And if you use, if I may just allow me to touch a little bit. Here you are, right? All I did was I did a slight tip left. The right in front, are you happy? So if you're happy, then just ask for the camera. So when you're doing ERCPs, when you look at the ampulla with experience, you should start thinking what would be your modality, how would you go? Would you go non-touch? Would you go touch technique? I mean, non-touch is advancing your wire a little bit and touching the ampulla with the wire, or would you go in with the ampulla? So with just the cannula itself. That's experience based. So yeah, good, good. Very good. Excellent. Yeah, excellent. Yeah, you can engage and then change your angle if you can engage that. Yeah. So if you can notice, we are using scope advancement, pulling back, subtle movements to get the right position, okay? Advance the scope a little bit more. And then pull back. Sort of a big wheel to apni taraf. Yeah, well done. Now lift it up with the elevator. Pull back your cannula a little bit. Yeah. Do you use the elevator when you're going in the ampulla? Is that something that you used to do?
Not all.
Yeah, I use a lot of it because if you want to aim yourself towards the bile duct, elevator helps just engaging. But you do what you think you're comfortable with. Good. Take your time, get your right position. When you're comfortable, you do what you have to do, okay? There's no rush. See, I'll tell you what's happening is, but what's happening is, because you're not using the elevator, as you're advancing, you're going. As you go there, if you use the elevator, you will be able to do that. I mean, you can do the way you do it, and then you can see, as you go close, you can use the elevator a little bit, get yourself hooked here, right?
So I guess what I'm thinking is I want to be going this angle.
Yeah, but first get yourself engaged. You can change the angle when you've engaged yourself, right? Your position is pretty good to me. Yeah, elevator, thoda sa upar karke. Yeah, perfect. Engage yourself at this position and you'll be in. Good, good, excellent, very good, very good. Now, just stop, pause and see where is it going and where do you have to go, right? So how do you get this position going that way? The first thing you need to do is, because you're nicely engaged, you need to bring your cannula facing this way, okay? How would you do that? Yeah, I think so. Try and see. We've got time, so we'll see what it does. Bring it towards the left. Yeah, keep going. Keep going. Now pull again. Okay, now advance your scope just gently. Halka, halka. Halka. Right? Elevate your, if your elevator has a, yeah, good. Now bring the big wheel towards you. Yani tip up. See? Tip up. Is it max?
Yeah.
Max?
Now it's max.
Now it's max?
Yeah.
Right. You can ask your tech to see if they can advance the wire. Flora, please. Our position is, yeah? No, yes. No, okay, fine. So we are obviously not. We're nicely engaged. At this point, that's good. थोड़ा सा away करो, थोड़ा सा tip away करो. Just a little, yeah. This, yeah, good. Now you have just advanced your cannula in a little bit. Try wide. Okay, no. Pull back. Pull back. Little bit. Cannula को थोड़ा सा उठा के वापस elevator से उठाओ. Careful. Use your small wheel. Is it complete left? Complete left है? Huh? Make it complete left. Right, complete left.
Now it's complete.
Right, complete left. Okay. Now big wheel towards you. Pull. Okay, wide now. No? Okay. No problem. So one option I'm sure you've done before is bowing your sphincterotomy a little bit. So we came out no problem. थोड़ी सी पोजीशन को वापस से कर लो right away. मतलब small wheel right कर दो. So you go and okay, good. You can go in this position and get yourself hooked. Yes, good. Good. Elevate more. Is this max?
Yeah.
Right. Just gently advance your cannula. Right. Now, bow do ya. Give him a bow. Slowly. Thoda sa big wheel, sort of, the big wheel down. And again, thoda sa pull back for a stroke. Big wheel तुमने कितनी बो की है? Go more. Go more. Go more. Go more. Now you need to change your position, right? So I would just advance the scope a little bit. Okay? And if you just turn yourself towards this wiring, okay, that didn't work. थोड़ा सा डिस्टेंस से फिर आप ट्राई करके देखो. Good. Just would go in. So you have to. So there are multiple ways of changing the direction. So we've tried a few already. So in this case, maybe we need to go from a little distance and try and see if we can use the bowing technique. Yeah, not bad. Okay. Your position from here, I wouldn't be bothered about the position so much. You can advance the cannula. See if you can engage yourself. Yeah, lift the elevator a little bit more. As you are in, elevator more. Elevate the, more, elevator more. Right? Now you can advance the cannula and see because your direction is right. Can you advance your cannula a little bit? Yeah. Try the wire, please. Here, you're in. Fluoro. Fluoro, please. Yeah, we are in CVD. Well done. So now what do you want to do? What would you do? It's your patient, not mine.
I don't mind it.
Let's do it. Do whatever you want to.
A
A little bit, yeah, fine. And great. So we have a filling defect, it looks like. We have a nice cystic duct. And we have some stones in the gallbladder. You want more injection, you're happy.
stones.
Yeah. So take that picture, please. Thank you. So now you want to cut, right? So do it. Are you happy with the position? So I would not, I generally I don't want to take my cannula out until I've positioned it nicely. Until I'm happy with the ampulla, right? Because once the cannula is in, you can manipulate your scope. But once your wire is in, the wire will come out very quickly. So manipulation should be done when you've got the cannula in, yeah? Right? So what you want to do is, you just show me where do you want to cut?
I mean, I would cut this way.
Yeah, perfect. And I think you don't need to do anything here, yeah? Except just pull back and, yeah. Just see what it does. Okay. Yes. Obviously, this is not the right position, so I would advance the scope a little bit. Right.
So you want this to be sort of here?
Yeah. You want the cut to go.
Yeah.
This is going towards 2 o'clock.
Yeah.
We want to go between 1 and 11, right? So advance the cannula in. पहले तो सबसे थोड़ा सा और अंदर कर दो. Yeah, keep it in, let it go deep, And now you position yourself, whatever you want to do. You can use the scope, you can use your shoulders, and see what happens if you turn.
Yeah, this way.
Yeah.
More.
This is more. This is better, right?
Yeah.
So you can try that. If you're happy, just bring it out. If I feel you're doing the right, I'll tell you. Otherwise, you just go ahead and do what you're. Sometimes your initial cut would be going this way, but remember now we do wide-guided sphincterotomies, right?
Yeah,
So unless you're completely out, you're probably not going to. So as your cannula goes in, you get the right position, but when you come out, actually falls a little bit. So you just need to adjust your maybe the shoulders. See what happens. Okay, now you see what has happened. So every movement that you do, see again, just for everybody else, can you see we are going away in the other direction, and just to change your shoulders direction, looking at that brings you right. The idea of this course is not to be successful, is to understand the basics, understand what the movements do. I'm happy with that, but if you are happy, go ahead. थोड़ा सा स्कोप अंदर डाल दो, just a little, just simple, yeah. I would be happy. Just pull back the catheter a little bit, just to see where the tip. I don't know, but मेरी practice में I always take it out and then go in, so I know exactly how much I want. Least contact, the best cut you get when you have very little contact. You happy? Yeah. Try. If I'm not happy, I'll let.
Half four.
Yeah. Also, it's advanced कर दो cannula, so you will get a little bit better. It's important that the half bow is very important. थोड़ा सा scope को अंदर कर दो, just a little. You will get a better distance. You see? Now you can do a little bow. Yeah. I think this is a good cut.
As I'm cutting, I tend to
Use the elevator.
Yeah.
Yeah, use the elevator as you're cutting. Our aim should be that we just go in one smooth direction. Okay, so I'll pull back now. Cannula, just the cannula. So you've got a little bit more than what we would want. So here, I would elevate a little bit again. Yeah, no, sorry, I bridge it, go a little bit more. That's it. Now advance the cannula again. And now cut. Elevator also.
cut more.
Yeah, I think you're in the right direction. Okay, stop. So we are coagulating a lot and cutting less. That's probably because we have a little bit more wires. So pull back your cannula completely till you see the wire. Okay, okay, okay. Now go in again. Little bit, just go in a little bit. Go. Elevator up. Right. Now try and cut. And see, 1 minute. If the wire is touching like this, you will have more coagulation. So we will move the wire a little bit away from there. Okay. Right. Now cut. See? Okay, how far would you cut? How far are you comfortable? So you're okay up to here, bilkul safe, right? So go. You see bile, which means you've done something. Go ahead. Cut. Yeah, cut. That's it. Stop. At this time, what are your thoughts? How dilated is the CBD? Not much. It's almost 2/3 of the scope, or maybe half, right? So the stone's not too big. So the option you have is you've had no bleeding, you've got a nice cut. One option you have is you extend, check, put the cannulation again. You can do that. You can bring it out and see whether you have more space to cut. Even if you have more space to cut, you have to ask yourself, do you really need to cut more? It's clean, there is no blood. Next cut may be bleeding. With a small stone, I think we should be okay. I would put a balloon. Maximum, we put the sphincterotomy again and extend the cut. Right? See, if we cut more, we can't reverse it. We cut less, we can always go back and cut it. And as you get more and more experience, you will be, that's not a problem really. It's being safe and taking advantage of when the luck is with you and there is no blood. Right? So, you do whatever. Exchange kara. So exchange may, you've got what do you do normally with exchange?
So once the catheter is
Out,
of
yes.
the screen, I would lock the bridge.
Absolutely.
I tend to just do a quick screen check to see if the wire is...
Okay, good. Do. That's a good point. Well done. Goes fluoro. Yeah, your wire is fine, right?
So then I can start...
So now you can start. Yeah, well, you don't really need to do the screen as long as you're looking at the, I mean, like endoscopy, you can see the wire, and as long as you're yellow, blue, whatever color wire you have, as long as it's not moving, you're good. Yeah, so wire आ गया, wire निकालो. It's important to always hold the wire where you're holding. Can you show this here, beta? Can you show his hands? कौन है यहाँ पे? Video वाले? Can you see Arif's hands? Sajda, Shanil, can you hear me?
Asad, what is it you wanted to show?
No, I was just wanting to show when you're actually wire exchanging, it's important to have your elevator up, and once the cannula is out, make sure you're holding the wire at the end there, just at the biopsy channel.
Right.
Because it can slip out very easily, especially when you're in the pancreas where the wire doesn't go too deep and you don't want it to go too deep. You just have to hold it. Slippery wires just come out very quickly if one is not careful.
Yes, totally agree.
Would you give something, or would you give Buscopan there? But
You want to give Buscopan here?
it's okay, I think.
Why would you want to give Buscopan? I just ask. We can give him Buscopan, but
And some peristalsis, but it's not that.
Is that stopping your view?
No.
Is that stopping what you would want to do? If it's not, then best not to be given. थोड़ी सी suction करके you can, yeah, that's fine. You can see the You can see the gallbladder with full of
Stones. yeah.
stones, small stones. And this is the one that worries me. If the lap chole is not going to be done very early, then there is a possibility you may the patient may pass another stone. Well done. Yeah. Keep going in. Yeah. Go in. You can see this. Screen, please. Okay, fine. Go ahead. Go ahead. Go up. Right, screen. Okay, right, that's good. Right, now what is your practice normally?
Well, I tend to get at 12, I guess, and then do a
Okay,
12.
okay, so you can do that. I generally tend to put a little bit of dye, so I know there is no stone above, and then I would inflate the balloon and then do the trawl. So without inflating, we inject a little bit of dye. Right, screen please. Right, so there is nothing above. You pull back the balloon, bring it to below the hilum. Right, stop there. 12 mm, it should be good. Yeah. 12, karo beta. Okay, you just pull back. For even pulling this balloon from here, you can just do this and it will come down. Right? Screen. Okay. Yeah, you're out. So we don't know if a stone came out or not, but we go back up again. Do an occlusion cholangiogram and worry about the stone later. Is that what you would do, or?
Yeah.
You know? You can actually see the stone if you are pushed because it makes you feel a little better. But then you have to change your position and advance and see with the big wheel away, you will be able to.
Another trawl with a slightly bigger, but the duct is
Okay, no problem. You can do a bigger balloon as well. It's an expansile duct, so I don't think balloon trawl, in my experience, it doesn't make any difference. So screen please. Right. Now you can do an occlusion if you want to, or there's enough dye, so if you just inflate and pull back, I think you'll get an occlusion. Yeah, right. If you wanted more, or you're happy.
That's fine. We'll slowly
Okay.
inject dye as I come
You
out.
just keep injecting dye, keep screening. Right, 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 right. So okay, good. So it came out even without that. So sphincterotomy is pretty good. Replay. Right. Okay, I think, is there anything else you want to do? I'm pretty happy. No, there's nothing because there isn't anything. So we're done. So take the balloon out. Right. Nikal lo. Take the whole system out. And now I would like to see the ampulla.
Take the wire and everything.
Yeah, everything. I just wanted to show you something, if we can see it. Just put some air in. Put some air in. सिर्फ एयर ही डालोगे आप वहीं पर आ जाओगे. Just that you suck, right? Pull back your scope. Yeah. Now just put some air. Actually, the pancreatic duct was very nicely seen, so I'm hoping that we can see that. Okay, we are done here. Yeah, unlock the wheels always, because most of you lock your wheels. Make sure once you're done, you unlock your wheels. You don't want to pull the scope out while the wheels are locked. Okay, we always do air ka chakra. Let me show you one thing. Quickly, I wanted to show you a couple of things. If you are stuck, this is Khalid Hassan's way of intubating, and he goes in. I don't know if you saw, because I don't know if the hang up.
I've seen a video do that.
Okay, so you turn the big wheel towards you, or up position, right? Right, your scope is like this. Light on, please. You go in that position and you turn it, and you should always be where you want to be, okay? And you can do it under direct vision, as I was explaining. You see, you can see the two piriform fossas, and you can actually do it. Most of the time I do under direct vision. I prefer that, but obviously. So when you're done with your procedure, what we were trying to explain, and I think what a lot of people were asking me, where if you can focus at my hand here, I've gone into the stomach, you see, just there, right? We just entered, and I go a little bit anti-clock, and look what I'm going to do. All I'm going to do is just pull my hand up back here, and then a little bit of big wheel towards me or up, tip up, and we are just there. And when you come out, it's my practice, but so I would do the reverse. I would want to take air out of the fundus. Especially if you're doing pediatric population, it's very important to take all the air out. The anesthetists are very happy with that. Well done. Can we